the South African Medical Association Trade Union's General Secretary, Dr. Cedric Sihlangu, joins us now for reaction to the Minister's announcement. Dr. Sihlangu, good evening to you. Thank you so much for your time. Okay, 1.3 billion rand allocated for hospital equipment purchases and 1,650 new healthcare positions to be advertised. Are the numbers enough? I think that's a good place to start.
Evening, Naledi, and thank you for having us. I think I can start by saying that I think many doctors in the country today are smiling, and of course many healthcare workers as well, understanding the nature of how we work in the facilities where doctors work with nurses and other allied professionals. So as SMATU, we in fact welcome the announcement by the Minister. We think it's obviously long overdue. You know, our view, in fact, is that every month that passes by with a doctor out of a hospital not being in employment, it's actually a tragedy. But we must express our gratitude to the intervention by the National Department of Health, because we do understand that over and above all the efforts that many of us have put in to address this issue, you know, trying to push Treasury, we've had many marches throughout the country. It has all culminated in this. And of course, we can indicate that even the National Department of Health and all the provincial departments have tried to raise this issue with finance. So I think today we're able to say we are going to get those doctors in employment. Most importantly, they'll be serving our community, which is most important, in fact.
Yeah, but I want you to help me with the numbers, because my understanding, and according to, for instance, Sisa, you've got, and you'll help me if I might be incorrect here. Sisa reporting in March this year that we have 1,800 unemployed doctors, and so the minister saying 1,200 doctors' posts will be advertised. So are those numbers making sense? Could those other 600 be found space?
Yeah, so remember, from the moment when their contracts came to an end, which is about 31st of December, some of them have actually gone into employment, some, not all. Some, of course, they would have gone into the private practice. So the balance, which is about 1.8, I mean, our numbers were giving us about 1,000, about 1.2. So that 1.2 is a good buffer if you think about it, that we were having numbers around 1,000 or so, and we have posts that are going to be funded, which is 1.2, which essentially will likely absorb all of them. In fact, we don't anticipate that we'll be having any unemployed doctors should the provincial departments actually do what they're meant to do, which is initiate the recruitment processes and have all of these doctors in employment. In fact, we are hoping that there should be no undue delays, because if you think about it, these doctors have been out of employment since the beginning of the year. So we are now in April. So it's 4 months down the line.
Yeah. What's your
understanding? If you have another 2-3 months, it will take us to June, which will be unacceptable.
Okay. What's your understanding of why this hasn't happened, I mean, just over the previous years? Because certainly the issue of unemployed doctors has been one that we've been discussing for a few years in the country. So, I mean, what do you think was the problem? Is it a change in leadership? Is it that simple?
No, we had a meeting with the finance minister, and he was quite frank. There really has been austerity measures in place throughout government, not only, you know, affecting health and education, but affecting all, you know, spheres of government, including the military. So that has been a lived reality of South Africa, where there have been budget cuts year on year. And I mean, it dates back for more than 5 years, some say 10 years. So indeed, it is because of that has resulted in this ongoing situation where every year the purse becomes smaller and we can't absorb critical skills into critical jobs. So what has happened this time around is that with the direction that government was taking through finance, is that they said, well, look, we need to find money somewhere and we need to employ these critical skills, because it just doesn't make sense for a developing country not to prioritize skills in sectors such as health, because understanding that to grow the economy, you need a healthy nation, and to get a healthy nation, you need to have a sound healthcare system. And the healthcare system was collapsing, and you had to then do meaningful investment in that sector, and this is part of it.
There's of course the cancer crisis and the resources that oncology certainly faces in the country. And I'd like for you to characterize it for me, because it certainly isn't just the issue of us needing to bring more specialists into the field, particularly in public sector facilities. But there is also the issue of radiology machines, the equipment, the equipment that is necessary. You've got, for instance, the minister detailing plans to, I think it's 1.4 million rand hospital items to address critical shortages. Is that enough? And how deep is, I suppose, how big is the hole? Yeah.
It's humongous. We don't think that this will cut it. I mean, 1.3 billion is a good start. It's a step in the right direction. I mean, if you look at the items that are listed there, it's obviously ICU beds, general beds, it's hospital mattresses, it's linen. Those are critical things that they make your experience of being in hospital slightly more humane, and you actually are treated in the manner that you should have a bed to sleep on and so forth. So those are the basics. If you were to think of, for example, the Maslow's hierarchy of needs, that's more at a lower level on the basics. When you speak of radiology equipment, when you speak of oncology equipment, those are the super expensive equipment that, in fact, in the whole country, only few provinces have those. So our view is that to begin to get some reasonable, equitable access to healthcare, more and more provinces ought to have those kind of equipments available, but more importantly, the human resource, so the specialists, the oncologists and so forth. Now at this stage, we're far from it, but more importantly, the private sector actually pulls that resources because of the sheer market forces. That resource gets pulled towards the private sector. Maybe something like the NHI will sort of equalize the playing field and make everyone have some sort of equal access to these kind of resources.
Sure, I must say I quite like your use of words when you talk about what is being prioritized here in this 1.3 billion. Really comes down to the lower rank of Maslow's hierarchy of needs. 80,000 mattresses for 38 million rand, 66,000 bassinets for newborns, linen items that will see 1.2 million rand, bed sheets and pillows for 273, and that's the lower rank of Maslow's hierarchy of needs, which is a great example of characterizing it, because then I start to think, when I ask you about the shortages that PEPFAR cuts then bring in, am I asking for something that is all the way up there and is not a priority in terms of resource allocation?
I think the minister put it very well today. And let's just make it very clear. I think this is actually important. These items that we've listed, remember we had a situation, it could have been Northwest, I stand to be corrected, where babies were being put in boxes.
Indeed, it was the Northwest, yes. Yeah.
It was Northwest. So this is a decisive direction to correct those kind of situations. So you've got to start somewhere. Now, when we speak of, for example, the cuts in terms of PEPFAR funding and issues of ARVs, again, the minister came out very clearly to say there should be no South African who does not have or get access to ARVs as a minimum. Understanding the cuts, there's still a clear and decisive stance of the department to make sure that, of course, there was about 90% of all ARVs being paid for by our government anyway. Now, that bridge in the extra 10% is to ensure that every single South African is able to access ARVs. So that in itself tells you that the attitude of the department is that it is priority. And of course, it's for the department again, and the 9 provincial departments to try and pool resources. You'd have heard of some clinics being closed down, those that were run under some of the PEPFAR funding. It doesn't mean that you shouldn't be able to access a clinic. It means that you can go to the next available clinic, and in that clinic, you should be able to get ARVs.
Okay. Because the minister, of course, also talking about the Global Fund having allowed us the opportunity to order 1 billion rand worth of ARVs. So we hope that will be sufficient. I want to move on to other issues, though, because there's so much to talk about. You've got, for instance, the legal issues that the NHI process is facing. Many organizations still saying, well, how are you going to fund it? We've got a few suggestions. But when we look at some of the allocations that the minister talks about today in terms of, using some of that allocation from Treasury, I wonder what your opinion is on our availability to execute NHI with the pool that we've got coming from Treasury right now, can we get there?
Yeah, remember, even though the NHI is being rolled out, the National Health Insurance Act, it is being done so in an incremental manner. So it doesn't all come into effect at once, meaning that you don't suddenly get a situation where everyone wants the top tier level of care at instant. So what it means is, as the rollout happens, you will begin to see allocations to the more critical areas. For example, maternity and neonatal care, meaning the vulnerable women who of course go into labor and give birth. There is a clear, decisive prioritization there to say that will be part of the early rollout for NHI.
Okay.
So, of course, you might not have all the money now, but you still have that opportunity to sort of incrementally observe as you're rolling it out.
Okay. Yeah, that's an interesting one. Before I let you go, I couldn't speak to you without bringing this up. Samatu, you're looking, and you can tell me where you are in the process of pursuing legal action against the Gauteng Department of Health in an issue about doctors' overtime?
I think the minister touched on that as well. Unfortunately, we had a very progressive engagement with the DG of the National Department of Health about this, where a circular has been issued to all the provincial HODs to stop this sporadic changes of the current configuration of overtime. So what that actually means is it places in abeyance this process of different provinces doing their own thing, similar to Limpopo, having something called shift or flexi system. So the current understanding is that with the new task team that the minister announced today, that will be the actual subcommittee or ministerial advisory committee that will look in holistically on issues of policies in the department, for example, the community overtime policy and others, such as your RWAPS policy and so forth. So until that committee has done its work, we don't expect any of the 9 provincial departments to be doing their own random things, similar to what Gauteng was attempting to do. Of course, they've placed it on hold, and we appreciate that. We've had a meeting with the HOD, and we found each other. And similar other provinces as well. It happened in Mpumalanga, we found each other. We're just hoping that the same thing will happen in Limpopo, where they'll go back to the normal way in which doctors work and wait for the minister's committee to conclude its work.
Yeah. Okay. And final one. I'm optimistic, though. I think this is what I want to hear just as we wrap up. The announcement from the minister today, we're optimistic about where the health sector is headed, from Matu's point of view.
From where we are seated, we think it's positive, and we think that it's taking health to where we hope it will allow at a better place. So we're not pessimistic at all. Okay.
An optimistic ending there with Dr. Cedric Sihlangu, General Secretary of SAMATU. Thank you so much for speaking to us. We certainly do appreciate your time. All right.